And joining me via Zoom to discuss the ongoing strike by the Nigerian Association of Resident Doctors is the first Vice President of the NARD, Dr. Arome Adejo. Good to have you join us, Dr. Adejo. Because yesterday at that meeting, one of your representatives who was at that meeting with the federal government delegation did say that two out of your requests have been met. One other one has been met halfway, thereabout. He listed some of the things that have been met halfway. One would have thought that with all of these dialogues still ongoing, you would suspend the strike. So talk to us about your reasons for staying with your ultimatum to the federal government.
Good afternoon, Nigerians. Thank you for having me. Well, I don't really understand what you mean by one of our representatives saying that our demands have been met halfway. I was there throughout life, and the main truth is that, you see, in any negotiation, there are some basic things. You cannot tell me that you are owing a medical doctor for up to 4 months. The doctor has been working for 4 months, and you are still asking that will give you 3 weeks to pay the doctor. The person that is asking that will give in 3 weeks, the person has been paid for the past 4 months. It's not fair. I don't think any reasonable, any sensible association will agree to that. Meanwhile, for the past 4 months, we have been advocating, we have been pleading that these people have not been paid. What is the problem? Pay them. So there is no how you can meet us halfway when the doctors that are working have not been paid for 4 months. There is no how you can meet us halfway when insurance of our fallen heroes have not been paid to their next of kin. There is no how you can meet us halfway when in the midst of poor welfare, we are being overworked because our members are leaving this country every blessed day abroad, brain drain. There is no how you can meet me halfway when you poorly paid me. I suffer to do the work of 10 doctors. Come on, man. You can't meet me halfway when these things are not done. Oh, do you want our members to go back to the hospital and work and slave and fall and faint and die? Even the people that preach the work of God, they have to eat. So we also have to eat. We are human beings. Unless you tell us that we are not human beings, that we are robots, then I will agree with you. So as far as I'm concerned, the government have not met us halfway because there are some basic requirements to call off this strike. Meet it first.
And I like that you talked about, Dr. Adejo, I like that you talked about basic requirements, which is what I was just going to ask you about. What are some of the things you want to see the government do before you call off this strike? And what are you willing to compromise on anything?
First thing first, I was very happy when I heard that the Honorable Minister of Labour and Employment was saying that we went on strike during festive period, because it seems to us now that they don't want us and our families to survive the festive period, but they want us to work. So the basic requirement is this: pay the people that have been working for the past 4 months their take-home pay. Some of them have exams next month, and they are not under sponsorship. They have to pay about 500,000 naira for the exam. That is up to 4 months' salaries. That is number one. Number two, our fallen heroes, bring out the check for their insurance. You said they have been insured. If they have been insured, there is somebody somewhere eating the money. Bring that person to book. Someone somewhere is eating and is very happy, while the person that died sacrificed his life for this country, the families are suffering. That is number two. Number three, employ more doctors. Doctors are living in this country every day. As they are living, they leave their workplace. There are some also that are in the street roaming about, no job. What you see is the CEOs employing admin officers in the hospital where there is no doctor. You can see some hospitals, the number of admin officers is equal to the number of doctors. who are the backbone of the hospital, doctors, nurses, pharmacists, scientists. Employ them. Don't be employing admin officers. What are they doing there? So these are the basic requirements. At least when you pay, then you talk of the hazard allowance. Okay, you talk of the hazard allowance. And you see, I don't like it when they tell us that the federal government cannot talk with the state. To me, I feel that the federal government can talk with the state. If the state cannot,
Dr. Adejo, I wish I can hear
hospital.
Dr. Adejo,